Rowdy, come on.
Perfect. Ready.
Thank you.
One.
Sorry, I'm sorry.
We're doing pretty well at home?
Yeah, he's in the yard. He's walking in the yard, so.
Good. You are like foaming at the mouth for this treat. There you go, bud. Can he get up on his own when he's on the high traction surfaces?
Yes.
Yeah.
Okay, good.
Yes. He'll walk in and he'll like let's go.
Oh!
Rowdy. Are you stinky, bud? What do you think? You want to go outside?
When the girl dogs say if he's laying in the yard or sitting in the yard.
Yeah, buddy. Good job, bud. Most important thing is going to be at this point to get him up and get him out moving.
Right.
So using those back legs and strengthening them as much as possible. So going on walks or taking him out in the yard, things like that,
Okay.
and kind of making him do the standing part on his own.
Right.
So you can do things like sit to stand, so having him sit like this, and then asking him to stand up, and then immediately sit back down and stand up, sit and stand up instead of just sitting and walking. The other thing you can do is when he's standing, you can take away one of his back legs for 15 or 30 seconds and then switch so that he independently has to use each of them to hold himself,
Right.
and that'll help to
That
strengthen
might be
him
more
as well.
aggravating.
Yeah. So at this point, from a surgical standpoint, he's should be healed from surgery.
Okay.
So I'm not concerned about him getting an infection or hurting the surgical site or anything
Right.
like that. So he can be around the other pups.
Okay.
I still don't want him trying to do too much. Who is that? Did you just come to say hi?
I did. I was like,
He must have smelled you because he got up and came straight to the
oh
door.
my goodness.
And now he's,
Hello.
yeah.
Oh, you look
He's doing really well,
awesome.
Mojave.
Yay.
Yeah. So let's do it. Rowdy.
Hey, bud.
Good, how are you?
Good.
I'm holding.
All right, Rowdy, how you doing? Let me. Now that you've sat down, do you have a leash for him? We can go outside and on his own and he'll.
Yeah.
Come on, Rowdy.
Just be easy.
You wanna go home?
You want this? Rowdy, come on.
Perfect. Ready.
Thank you.
One.
Sorry, I'm sorry. Sorry.
No, it's okay. That was my fault. I forgot the tea.
Is it Nibbler?
The house. So for the next 4 weeks, I still want him only going outside on a leash and harness to do his business. Then after that, he can return to normal activity.
Okay. We generally leave him out for about an hour
Yeah.
because he has the cooped up feeling. He hates it. So he stays out for about an hour and then we bring him back in. And he seems to do good. We don't leave him out in the rain. It's
Yeah, I just
something we
don't want
do.
him doing too much. I don't want him to
Oh, no.
overexert himself and hurt himself.
He's,
He's just sitting soaking up rays.
oh, yes.
Take care.
Get home safe.
Yeah, I'm a dummy.
I think he doesn't like men.
Yeah, I mean, it was still
Alright, so.
6 years. You're finally right. Rowdy full on.
Full on try.
You know this.
I forgot though.
No.
So dog bites are obviously a risk of our job.
know.
It's a risk that we have to be willing to take each day. If you do get bitten by a dog, immediate steps for kind of first aid are to control bleeding if there's any bleeding, to wash it out thoroughly with soap and water, bandage it if it's appropriate, and you should definitely see your human physician, doctor, as soon as possible to assess the wound. Sometimes wounds are deep enough to need stitches. Lots of times you should get antibiotics following a wound. And depending on the rabies vaccine status of the pet, sometimes your doctor will recommend rabies prophylactic prevention. So Really important to see your doctor after a bite. And take those first aid steps right away.
We take care of our bosses too.
But when he's on a high jump, oh my god, he's ours. So yes, nope. Oh, you're getting a Band-Aid.
Yeah, where's Boo Boo?
Rowdy's still weak and wobbly in all four limbs. I didn't get a great examination of him, and just that he didn't want to do anything, but he's still obviously ataxic in his pelvic limbs. He'll continue to improve. He had the big disc at C5, C6, so he's improving.
He is a 5-year-old male neutered terrier mix. He's presenting today for acute non-ambulatory tetraparesis. Yesterday he got into a little scuffle with another dog. While they were being separated, he kind of stumbled and fell, and then suddenly couldn't walk after that in all 4 of his legs. On his examination, he is non-ambulatory tetraparetic severely. He only has motor in the right pelvic limb. He's got absent proprioception in every limb except for the right pelvic limb, in which it is delayed. He's not super painful. He has all of his reflexes in all 4 limbs. His cranial nerves are normal. Mentation's pretty normal. He's nervous. But otherwise, localizes C1 to C5. I chatted with the owners about possible causes. So a disc is possible from, if he did stumble and fall. A concussive injury is possible, although it doesn't sound it was super traumatic for him. Or things like FCEs are possible, hairline fractures are possible. I think anything else is pretty unlikely, like a neoplastic process or a meningitis, just because of his history of having that trauma. But the owners have agreed to do an MRI.
All right, Jeter.
Those cookies.
Non-ambulatory. There are 3 of them.
I know. Look, it's perfect.
Hi, nice to meet you.
I mean, it certainly sounds like the right thing to be doing. Just as severely affected as we are when we can't use all 4 limbs, we need to find out the underlying cause. The cause might be something, easy to fix. It might be something that we need surgery to fix, but still has a great chance of getting better. It might be something that doesn't need surgery and has a great chance of getting better. Or it could be something that requires medication, etc. So, each one of those carries a different treatment, carries a different likelihood of getting better, and that's why doing tests is so important. So,
Thank you.
alrighty.
Sorry, you guys are going to the dog got you before?
Yes,
I saw it through the window.
Yeah, that was
You got him.
glad I didn't curse loud or anything like that.
Right.
People watching.
He got you.
It's not
I think
bad.
I got him.
I'm Dr. DiVita. It's nice to meet you.
The same, the
Nice to
same.
meet you. So I understand that she's been a little bit less active over the better part of the last week, but we kind of didn't see her having trouble walking for the last few days. And last night was the last time that we physically saw her walking. Is that correct?
That's correct.
Okay. On her exam, from kind of the shoulders up, she looks normal. So all the nerves that go to the face, the front legs look normal. The back legs is where we have our issue. So right now on my examination, she's essentially paralyzed, so she can't move those back legs, but she can feel the toes and she can feel her tail. That's good news. That's one of our big prognostic indicators. When we look at a neurologic patient, we grade them on a scale of 1 to 5. A grade 1 is just being painful, so she would only have back pain if she were a grade 1. A grade 5 is being paralyzed, so not being able to move the legs, but also not being able to feel the toes. So she's right before a grade 5. She's a grade 4 right now. But that still means, depending on what the underlying cause is, that she could have a good shot at getting better. So in terms of underlying causes for, kind of an adult age Chihuahua mix with her history, far and away the most likely thing and the most common thing that we see is going to be a disc herniation, just like in people. disc that lays in between the bones of the spine and normally acts as a shock absorber gets weak over time. It can herniate out and put pressure on the spinal cord, which interrupts the signals from the back feet to the brain and from the brain to the back feet to coordinate movements.
Doctor, I have a question. That happens spontaneously?
Yes, unfortunately. Our small breed dogs, Chihuahuas, Shih Tzus, Terrier mixes, all of those, are born with genetic predispositions to having weaker discs. So it can happen in any dog, but in those smaller breed dogs, we see it at a younger age, and we see it with a very sudden onset, as opposed to some other dogs, we see more of a progression.
Right, exactly.
Yeah.
That's her case.
Exactly.
And
Saturday evening, she became inappetent, couldn't jump on the couch when she tried to, and then yesterday, she stopped walking. So last night was the last time we saw her walk.
Okay. But, hopefully we find a slipped disc. That's the most fixable thing. We've got 95% chances of getting her up and walking again.
full recovery.
So I guess when I say 95% chances, I'm talking pain-free, walking on her own, pooping and peeing normally. So I guess dogs that are as affected as she is, it's tough for us to, we don't like to say full recovery. That can still happen, that dogs get 100% better, but many dogs regain the ability to walk, they're comfortable, they're walking, they walk well, but they're still a little incoordinated.
She told me, yeah, she told me
so-
a little, I forgot
Like
the
a
word.
sway or swagger.
Exactly, your sway.
So-
But yes, I'm sorry for interrupting. I was telling her, I'm telling you the same. I'll do what it
Sure.
needs to be done, as long as it wouldn't compromise quality.
Sure.
So to me, it gets to a point that quality is more important than quantity, you
course.
know? But absolutely, the prognosis is so high, and she's gonna be able to recover her pretty much a normal function, like not stay incontinent, not stay immobilized, and not staying agonized in chronic pain. We'll do it. We'll do it.
Yep. So, and that's what the MRI is going to show us is it something that we've got excellent chances of fixing and doing all of those things that you just said, you know, her having a great quality of life and a long lifespan, you know, or is it something more worrisome where the quality of life isn't as good and her lifespan isn't as long? So that's where those tests come in.
Perfect.
Okay.
Great.
Have you had her pretty much her entire life, or?
Chiki was rescued from the streets when she was about 7-8 months.
Okay.
So yeah, she's 7.5 years old right now.
So you rescued her as a.
We found her on the streets. Yes.
Okay. Well, she's lucky to have found you. So, well, I'll leave this here for you.
Thank you.
It's very nice meeting you.
Thank you. The
We'll talk
same.
to you
The
this
same. Thank you
afternoon,
for
okay?
everything. Take care of my baby.
That's what
I
we'll
know you
do.
guys will.
All right.
I don't know if now's the time to tell you, but I've noticed a certain aroma or odor about you. You smell like up dog.
I was like, what are you about to tell me, right? I got really nervous.
No, Emily, not you.
Oh.
You both smell like up dog. What's what?
Up dog.
So close.
So close. What's up, dog? Oh.
Thanks for watching. If you enjoyed this, please give us a like or a subscribe. It'll really help us reach more people and help more pets. Thanks so much.